Today, I'd like to talk about positive psychology and how positive affect can actually improve your health. So, to start off with, we're going to be talking about the positive effects of a positive affect. We're going to be talking about the mechanisms of why positive affect can increase your health. We're going to go over some of the study designs and how they come up with these findings, and then we're going to look at future directions for the research. So, feeling good improves health. So, how does it do this? It can reduce mortality, so the rate at which people die and how many people in a study die. It can reduce morbidity, so your burden from disease and how much disease you have. And specifically, we can see increases of or decreases in morbidity in cardiovascular disease, stroke, physical decline, so having an inability to walk and other physical ailments. We can see a reduce in the hospital admissions, and we can even see increased survival from cold and a better chance that you're going to be able to overcome the cold in a shorter amount of time. So, as I said, positive affect reduces morbidity. So let's look a little bit closer. So we can see a lot of this research has been done in cardiovascular disease, and they see that you have a reduced cardiovascular disease severity if you have more positive affect. You have good positive emotions. And so this is thought to be linked with stress and your ability to reduce your stress. And so we actually see a twofold increase in survival or a twofold decrease in survival if when you ask these questions, you answered with, I have looked forward with enjoyment to things. And if you score higher on this, as in you look forward to things with a lot of enjoyment, and you have been able to laugh and see the funny side of things, you can have almost a twofold increase in your survival from diabetes. And then with HIV, you can have a lower viral load, so how much HIV is affecting you. And with cancer, we see better patient outcomes, and this again is thought to be related to stress. And overall, people report just having less symptoms if they have more positive affect. So now, how do some of these effects come into play? So there's this main effect model, which says positive affect can directly affect your health behaviors and your physiology, which then go to increase your immune and cardiovascular systems, which decreases your disease. But we can also see with arrow A that positive affect can help with your social, psychological, and intellectual resources, which can then go on to affect your health behaviors and physiology. So let's talk about some of the physiology. So positive affect has been shown to improve things like white cells. So how much white cells you have in your body. It can reduce your stress hormones. It can lead to less inflammation, lower lipids, specifically the bad lipids that are one of the key causes of coronary artery disease or cardiovascular disease. It can reduce your blood pressure and it can lower your heart rate. So a lot of this is thought to happen because positive affect can reduce your sympathetic activation, which is your fight or flight, which can cause a lot of these higher blood pressures, higher lipids, higher heart rate. And so now we go back to the main effect model and we can sort of see how positive affect can help your physiology. So now let's go into the social influence. So if you see here, this would be arrow A, how positive affect can lead to social resources. And so this is the social influence. And so as we saw in the last lecture, you have when you have positive emotions, you go up the positive upward spiral where you have the broadening effect from the positive emotion, and this allows you to recruit more resources. And so this can lead to stronger relationships. You may know you have an increased compassion when you have higher positive affect, and this can lead to better relationships, like I said. And your relationships can change your health habits, because if you hang around people who are motivated and who practice good health habits, you're more likely to also have those health habits. And so overall, in an entirely different pathway, we know that relationships and having good, strong emotional connections with people can also improve your health. And so this whole model we've been talking about is called the main effect. So what exactly is the main effect? So the main effect comes from the health behaviors and your physiology. And so positive affect has been shown to help with medication compliance. So taking your medications can help with your sleep, how much sleep you're getting, exercise, drug use, and hygiene. And so how much of this is actually because of positive affect versus your social habits? That's a little bit unclear, but we know that as you have higher positive affect, these are correlated. And so now when we think about affect, there's two types of affect. There's two types of positive affect: a high arousal positive affect and a low arousal positive affect. So a high arousal positive affect is going to be when you're super energized and you have a high arousal. You're really in tune with things and you're really high energy. So high positive affect, when you have high arousal with the positive affect, that has been shown to help with healthy eating and exercise. And it's more uncertain if positive affect can increase exercise, but that's sort of what the research is pointing to, that positive affect can help you do more exercise. And so, like we said, our positive affect go on to affect your physiology with increased white cells, less stress hormones, less inflammation, lower levels of lipids, lower blood pressure, and lower heart rate. And so then we sort of talked about the social aspect, where your friends and your increased bonds with your friends can help push you to do these health behaviors. And so now that was the main effect model, as we see back here, where the main effect model doesn't account for stress. But this next model is going to be the stress buffering model, which is basically the main mechanism model, but it adds stress. So we can see here that stress is also a factor in this. So how does stress play into causing us to be healthier? So when you have high levels of positive affect, stress has a less of effect on you. You're able to recover from stress faster. You have a reduced occurrence of stress, and you can recover from stress faster, like I previously stated. So what are some of the caveats when we're doing research? So a lot of research has been looked at, and it's not accounting for the absence of negative affect. So are all these positive affect causes really just that you don't have a negative affect? Well, all the studies I showed you before, they take into account that they factor in negative affect. So those relationships I showed you are taken into account with negative affect. So it's not the negative affect, because they checked for that to make sure that's not a confounding factor. And so that's been one of the big research caveats, is really making sure that we're only looking at positive affect and not just the absence of negative affect. And so another caveat is, what kind of arousal scale are we looking at? Because as I said before, there's positive affect with a high arousal and positive affect with a low arousal. And a low arousal will be feelings of calm, whereas a high arousal will be feelings of excitement, for instance. So how can we look more specifically at positive affect and take into account these arousal changes? Because, like I said before, high arousal positive affect can lead to different outcomes, can push you in a different direction than low arousal positive affect. And so then it's a question of, what scales are we using to measure this? Because a lot of the scales we're using are actually scales that are not intended for this kind of research. They're just the most popular scales at the time, and they're not specifically looking at this question of how does positive affect correlate with health. They're looking at a wide variety of things. And so then it's important to also look at the time scale of what we're looking at. So if we're looking at mortality, we're looking at a person's whole life. And so we want to make sure that we're not asking questions about how do you feel today, because how you feel today may not correlate with how you're going to live your whole life. So it comes into effect when we're looking at someone's affect versus someone's mood versus someone's traits. So we have to make sure that the time scale of what we're looking at, what we're researching, correlates with our outcome, as in mortality. So how does your mood affect your mortality is obviously not lining up the time scales, with the mood being only about a couple weeks or a couple months, as opposed to a trait, which might be better to look for in terms of mortality, because that's a lifelong trait you have. And so some of the future directions that I would like to see is, I would like to see a lot more research into the idea of arousal and how positive affect with different arousals can lead to different outcomes. high arousal versus low arousal. And I would like to see a lot more mechanistic studies because I'm really interested in how does your emotions actually change your physiology. I find that to be really interesting. And we need a lot more research into specific diseases because, like I said, most of the research has actually been in cardiovascular disease. And there hasn't been so much research focused into other diseases as opposed to cardiovascular disease. And so, with that, I hope you learned how your positive affect and feeling good can actually lead to better health. Thank you for watching.